Are you prepared to handle a medical emergency at home? Welcome back to the Bugging In Survival series. In today's episode, we're diving into a topic that's crucial in any survival situation: first aid and emergency medical care. Whether it's a minor cut or a life-threatening injury, knowing how to respond can make all the difference. In a world where the unexpected can and does happen, being medically prepared is not just an option, it's a necessity. And it's not just about having a first aid kit, it's about knowing how to use it effectively. It's about understanding how to handle common illnesses, how to maintain hygiene and sanitation in challenging circumstances, and when it's time to seek professional help. From building your first aid kit to recognizing the signs of shock, we're going to cover it all. So, are you ready to boost your medical preparedness? Stick around. No home should be without a first aid kit. A phrase we've all heard, but one that carries a weight of truth. Having a well-stocked first aid kit could be the difference between a minor setback and a major catastrophe. So what makes a first aid kit? Well, a first aid kit? First things first, your kit should have the essentials. These are items you'd typically find in any basic first aid kit, including adhesive bandages, antiseptic wipes, a pair of tweezers, medical tape, and sterile gloves. Don't forget about a digital thermometer and a first aid manual. It's also a good idea to include some over-the-counter medicines like aspirin, anti-diarrheal tablets, and antihistamines. Yet, a one-size-fits-all approach isn't always the best when it comes to first aid. You've got to customize your kit for your specific needs and those of your family. Do you have someone with a known allergy? EpiPens are a must. Asthma? Don't forget that inhaler. And for those with heart conditions, nitroglycerin tablets could be a lifesaver. Think about what you and your family need and make sure your kit reflects that. Now we've got the contents sorted, but where should you store your first aid kit? Ideally, it should be in a cool, dry place out of the reach of children. It should also be easily accessible in case of an emergency. And remember, first aid supplies don't last forever. Check your supplies regularly, replace any used or out-of-date items, and always ensure your kit is ready to go when you need it. Building a comprehensive first aid kit may seem like a daunting task, but it's a crucial step in ensuring your family's safety. It's not just about having the right supplies, but knowing how to use them effectively. So take the time to learn, to prepare, and to practice. Remember, a well-stocked first aid kit is a lifesaver. It's not just a saying, it's a fact. And it's one that could one day save you or a loved one's life. So let's get to building that kit. Having basic first aid skills in your arsenal can make a world of difference. Let's begin with cardiopulmonary resuscitation, or CPR, and the use of an automated external defibrillator, known as an AED. These are critical life-saving techniques used when someone's heartbeat or breathing has stopped. CPR involves chest compressions and rescue breaths that keep oxygen flowing to the brain until further medical help arrives. An AED, on the other hand, can restore a regular heart rhythm during a cardiac arrest. Familiarize yourself with these techniques. They can buy precious time in a life-threatening situation. Next, we delve into handling common injuries like cuts, burns, and fractures. For superficial cuts and scrapes, clean the wound with clean water, apply an antibiotic ointment, and cover with a sterile bandage. Deeper wounds might require direct pressure to stop bleeding, and in some cases, a tourniquet. Remember, keeping the wound clean is key to preventing infection. Burns, depending on severity, require different responses. First-degree burns can usually be treated with cool water and aloe vera or burn cream. Second-degree burns, characterized by blisters, should be covered with a non-stick bandage after cooling. Never pop the blisters. Third-degree burns are a medical emergency and need immediate professional attention. Protect the burn area from contact and pressure, but do not apply water or any ointment. Fractures, too, need careful attention. Stabilize the injury with a splint or sling, and try to keep the injured person as still as possible until professional medical help arrives. If there's an open fracture, cover the wound with a clean cloth and apply gentle pressure to stop bleeding. Finally, let's talk about shock, a critical condition often accompanying severe injury or trauma. Signs of shock include paleness, cold and sweaty skin, rapid heartbeat, and shallow breathing. If you suspect shock, try to improve blood flow. Lay the person down with feet elevated unless this causes pain or further injury. Keep them warm and reassure them help is on the way. Remember, shock is a medical emergency and requires immediate professional attention. With these basic skills, you can provide immediate care when it matters most. Common illnesses can turn serious if not properly managed. It's a truth we've all come to understand. Even in our modern world, a simple flu or fever can cause serious complications if left untreated. And in a survival situation, these common ailments can become life-threatening. So, how do we prepare for these common illnesses? Firstly, familiarize yourself with their symptoms. Understand what a fever looks like, how the flu manifests, and the typical signs of common infections. This knowledge will help you to quickly identify and appropriately respond to these illnesses when they strike. Next, stockpiling necessary medications. Over-the-counter drugs like ibuprofen, antihistamines, and decongestants can be a lifesaver when dealing with fevers, colds, and allergies. Also consider antibiotics for bacterial infections, but remember these should only be used when absolutely necessary, as misuse can lead to antibiotic resistance. And it's not just about having these medications on hand, but also knowing when and how to use them. Always follow the recommended dosage and consult a medical professional whenever possible. Overdosing or underdosing can lead to ineffective treatment or even further complications. But what if you don't have access to these medications? That's where home remedies and natural alternatives come into play. For instance, honey can soothe a sore throat, while ginger and peppermint are known to help with nausea. However, these should not replace professional medical care, but rather serve as a supplement or a temporary solution. Remember, it's not just about surviving, it's about thriving. And to thrive, you need to stay healthy. That means taking preventative measures like maintaining a balanced diet, staying hydrated, and getting enough rest. These simple steps can boost your immune system and help ward off common illnesses. In conclusion, don't underestimate the power of preparation and knowledge. Understanding common illnesses, having the right medications on hand, and knowing how to use them can make a significant difference in a survival situation. Home remedies and natural alternatives can also provide relief, but they are not substitutes for professional medical advice. Knowledge is power when dealing with common illnesses. So, equip yourself with this power and you'll be well prepared to face whatever comes your way. For those willing to take their preparedness to the next level, advanced medical preparations come into play. This is about going beyond the basics, delving into more complex medical knowledge and skills. Let's start with training opportunities for advanced first aid. There are numerous courses available, both online and in person, that can provide you with a deeper understanding of medical care in emergency situations. For instance, the American Red Cross and the National Outdoor Leadership School offer wilderness and remote first aid courses. These are designed to teach you how to respond when help is far away or delayed. You'll learn how to handle a variety of emergencies, from severe bleeding and broken bones to cardiac events. In addition to formal training, there are countless resources available for self-study. Medical textbooks, online forums, and even YouTube tutorials can be valuable tools for expanding your knowledge. Remember, the goal is not to replace professional medical care, but to equip you to handle emergencies until help can arrive. Next, let's talk about preparing for long-term care situations. In a prolonged crisis, you might have to provide care for an extended period. This could include managing chronic conditions, wound care, or even palliative care. Start by learning basic nursing skills, such as how to change dressings and bandages, and how to prevent and recognize infections. Also, consider stockpiling supplies. This might include items like extra medications for chronic conditions, wound care supplies, and over-the-counter remedies for common ailments. It's also a good idea to have a comprehensive medical book on hand for reference. Lastly, it's crucial to understand the limits of home care. Even with advanced training and preparations, there are situations where professional medical help is needed. Recognizing these situations and seeking help promptly can make the difference between life and death. This includes severe injuries, chest pain, difficulty breathing, and sudden severe pain. In these cases, your role is to provide initial care and stabilize the patient until help arrives. But remember, all the medical knowledge in the world won't help if you panic in an emergency. Staying calm, acting swiftly, and using your skills efficiently are just as important as the skills themselves. In conclusion, advanced medical preparations are not about becoming a doctor overnight. They're about being as prepared as possible to handle medical emergencies when help is not immediately available. From advanced first aid training to preparing for long-term care, every bit of knowledge and preparation can make a significant difference in a crisis. Advanced preparations can equip you to handle more complex medical situations. So go ahead, take that extra course, read that medical book, and always keep learning. Because in the world of survival, knowledge truly is power. cleanliness is not just about comfort, it's about survival. In the realm of survival, the importance of hygiene and sanitation can't be overstated. It's the unsung hero, the silent guardian that wards off many potential threats even before they rear their ugly heads. Let's start with cleanliness. It's not just about smelling fresh or looking good, it's about keeping harmful bacteria and viruses at bay. In the aftermath of a disaster or during a prolonged emergency, infections can become a silent, insidious threat. And in such situations, prevention is always better than cure. Simple acts like washing your hands, keeping your living space clean, and properly caring for wounds can go a long way in preventing infections. Moving on to waste disposal. When the power's out and the water's not running, waste disposal can quickly become a pressing issue. Improper waste disposal can lead to a host of problems, including the spread of diseases. It's important to have a plan in place. This could include composting, burying, or even burning waste, depending on the situation and the resources available. Lastly, let's talk about food and water safety. Contaminated food and water can lead to illnesses that can quickly become life-threatening in a survival scenario. It's crucial to ensure that your food is properly stored and cooked, and your water is purified. This could mean boiling water, using purification tablets, or filtering it through a quality water filter. Remember, cleanliness and sanitation aren't just about comfort or convenience. They're about survival. They're about ensuring you stay healthy so you can face whatever challenges arise. And in a world where the next doctor could be miles away or the next hospital visit could be days away, that's a priority you can't afford to overlook. Good hygiene and sanitation practices can prevent a host of medical issues. So, be smart, be safe, and remember, cleanliness isn't next to godliness in a survival scenario. It's right up there with food, water, and shelter. First aid and medical preparedness can make the difference between life and death in an emergency. As we've explored in this episode, establishing a well-stocked first aid kit is the first step towards ensuring your household's safety. From essential items like bandages and antiseptics to custom additions that cater to your family's specific needs, every component of your kit plays a crucial role. Beyond the kit, we've delved into the necessity of basic first aid skills. The ability to perform CPR, treat burns, cuts, and fractures, and recognize signs of shock are life-saving skills that everyone should possess. Remember, in a critical situation, your actions can spell the difference between a full recovery and a tragic outcome. We also touched upon common illnesses and their treatments, stockpiling necessary medications, understanding when to use them, and knowing home remedies can help you manage health crises effectively. But remember, while self-care is important, knowing when to seek professional help is equally crucial. In our discussion of advanced medical preparations, we underscored the importance of continual learning and training. From acquiring advanced first aid skills to preparing for long-term care situations, your preparedness level can significantly impact your ability to navigate medical emergencies. Finally, we highlighted the significance of hygiene and sanitation. Cleanliness is not just about comfort, it's about survival. Safe waste disposal practices, water, and food safety are all critical in preventing infections and illnesses. In conclusion, first aid and emergency medical care are indispensable components of any survival plan. Remember, knowledge is power and practice makes perfect. So keep learning, practice regularly, and keep your medical supplies up to date. Stay safe and well prepared for whatever comes our way. Don't forget to pick up your copy of the Ultimate Grid Down Survival Handbook on Amazon today. Also, if you aren't already, please subscribe and share your experiences in the comments.